Today's video was inspired by another recent experience I had clinically about a patient who had been back to see a consultant and was scheduled to have a shoulder procedure, which was a release of a tendon in the shoulder. Now, this was a complex, long history, which eventually culminated in this procedure. But I had made probably the mistake of not checking when the consultant review was, because I had already liaised with the consultant about 3 or 4 months ago, and then the patient went back to see the consultant with the injections having not worked, and was then scheduled for a biceps tenotomy, which is a procedure to release to cut one of the tendons that had become chronically inflamed. This was important for this individual because they were a wheelchair user, and that was their main means of propulsion. And I suppose I was surprised that the patient hadn't reminded me that they were going back to see the consultant, so that I could actually write a summary letter of what had happened to date. But I also would accept full responsibility that I hadn't inquired about when the next review was. But it brings a wider point, really, and it's certainly important that for you to be aware of this, that if you have a more complex condition, a simple condition can easily be managed with a sole practitioner if there are no other investigations required. But if it's a complex problem that's persistent, then it often means there are multiple people involved in the team. Let's take in a spinal situation. If there's a query on differential diagnosis, it may require an MRI referral, which is to a radiologist. It may require differential diagnosis of other conditions, which could be a rheumatology consultation to rule out other disease processes if it's non-mechanical, so to speak. If it's potentially surgical, it could be a neurosurgeon or an orthopedic surgeon, who are the two groups of surgeons who do surgery. Or if it's a neurological condition that's manifesting as something else, it could be a neurologist. So they can look for neurological diseases, if you like, and run a series of tests. So there are a lot of different people that can be involved in the team, and it often depends on where your starting point is as to whether you get passed around to different individuals. But the bottom line of it is that it's really important that each of those members of the team are aware of the opinion of their colleagues, because that profoundly influences the recommendations that they're going to make to you. And obviously, if you're the one who's the center of the discussion, then it's important that you know what the opinion is of the different practitioners that you've provided, and whether they're making that decision as an informed decision, having liaised with their other colleagues. So I was brought up in an era where it was obligatory to and considered an essential part of professional practice to write summary letters if patients were going back to outpatient clinics, certainly in the hospital environment, because it's not always realistic to expect you as a patient to be able to relay in detail what the therapist has been working with or what their opinion is. So it does help if that's been summarized in the appropriate way in order to relay that to the relevant other practitioners, so that they can make an informed decision. And that may be that, it's maybe self-evident that the condition is improving and following along predictable lines, so that's all good. Or it may be that it's plateaued and that there's no point in continuing with the from our point of view, physiotherapy rehabilitation, because it's not achieving anything more. Or it may be that there may be some other question marks that surface, and other investigations may be required. So there's a number of different options, and they all impinge upon the quality of care that you receive. So it is important that you take responsibility for your care and make sure that if you're getting opinions from different people, that you're clear on what their opinion is, and obviously have confidence that it's a valid opinion, that they've taken the time to examine you and listen to the history and try to assist with differential diagnosis. And in areas where there are grey areas, that those have been discussed, and the possible options of exploration of tests or of other specialists that may be involved to assist in management, that they have been discussed with you. So there's a lot involved there. But I suppose the basic point is that when health members of a healthcare team don't communicate well with each other, then decisions get made in isolation, and they're sometimes not the best decisions for your own welfare. So it seems like such a simple thing, but my impression is that there seem to be more and more links in the chain now in terms of management, and certainly more potential for things to fall through the cracks. And the example I used earlier was certainly one I would take responsibility for. So as therapists, we need to question and flag when the next specialist review is, so that we can make sure that we can summarize our input to date, and in order to relay that information to help in the decision making process. So it's not a particularly exciting topic, but one that we see happening very, very frequently. And probably the most common scenario we see is in older people who are taking multiple different medications, and they may have had several admissions either to A&E or have visits from locum doctors to D doctors, as well as their own GP, and various combinations of medication get added into the mix over the years. And sometimes people don't stand back and say, okay, well, why are you taking this? Do you need to take this with this? Or obviously, the more combinations of medications you start to take, the chances of having negative interactions of different drugs increases as well. So that's a real common scenario where it just ends up with a cumulative list of things that are added into the mix, and there isn't an overall a view on what should and shouldn't be part of a maintenance program. And that really goes to the heart of communication between practitioners. So I just thought I'd share that information with you, sparked again by a clinical experience this week. And I hope you found that interesting and relevant. I'll see you again on another video. Bye for now.